So my thesis was focusing on young people as they move kind of from adolescence and into the adult, smoking and drinking behaviours and how those develop in conjunction with kind of mental health, particularly anxiety and depression symptoms. The role of people's social and economic backgrounds might be indicated, say, by their parents' education or occupation, or their parents' income, and kind of how that played into kind of how their smoking and drinking behaviours and their mental health developed as they move into adulthood. I was using data from kind of big surveys that follow people over time as they're growing up. One of the main things I found was that being from a disadvantaged background is kind of really associated with taking up smoking fairly early, and then the people who do take up smoking then often tend to have problems with kind of heavier drinking and kind of more symptoms of anxiety and depression as they grow up then. The role of people's backgrounds has kind of changed over time, over the last sort of 20 years or so, as the UK has kind of introduced a lot of kind of policies aimed at kind of reducing smoking. Adolescent take-up of smoking had kind of dropped over time quite a bit over the last 20 years, but there's still kind of these quite persistent inequalities, and people from the more disadvantaged backgrounds are being more likely to take up smoking, and that's kind of being present despite all these kind of policies aiming at kind of reducing smoking. The reductions in smoking were kind of more concentrated among the older adolescents, and there was kind of less of a downward trend among the very youngest adolescents. Well, I think one of the things I'd really like to see is kind of strong consideration of the plain packaging proposals for smoking. There's a lot of data already out there suggesting that this can reduce appeal of smoking to young people, and in my research it was kind of the youngest adolescents where I guess the current policies seem to be having the least impact on them, and so something like plain packaging has potential to have an impact on them. Another part of my research was to do with drinking, and was finding whilst kind of people from more disadvantaged backgrounds were they began by smoking and then they'd often move on into heavy drinking. Those from more advantaged backgrounds were going on into kind of higher education, and they kind of found a route into heavy drinking that way. I'd like to see more consideration of ways to tackle heavy drinking in higher education. We all know about stereotypes of student drinking and things. And you do see some steps, like the University of St Andrews recently announced that it's running sort of student residences that are alcohol-free, which is, I think, an interesting step. For those from the disadvantaged backgrounds, they would tend to start with smoking and would then often proceed on to heavy drinking, whereas the people from more advantaged backgrounds, they would kind of skip smoking and go straight into heavy drinking. So like I said, the smoking was really tied to the background, whereas drinking was something that people engaged in kind of regardless of their background, but kind of took different routes into it depending on their background. I was funded by the CSO, which is the Chief Scientist Office. To get the funding, I had to apply and put forward a proposal for the research I was going to do. And one of the things I was emphasising there in terms of kind of the Scottish Government's health plan, three of its priority areas are smoking and drinking and mental health. And it also has kind of a priority in terms of focusing on reducing inequalities. And so my work really kind of fits in with those sort of strategic objectives. For the most part, things were fairly similar. We were sort of seeing similar things going on in Scotland versus the rest of the UK. In terms of the rest of the world, so the UK is actually quite kind of a world leader in terms of tobacco control, in terms of the policies we have. As part of the EU, we've had lots of things going on over the past 20 years in terms of restrictions on advertising, the mandatory health warnings on packaging for smoking and things. But in the UK, for example, we've had the bans on smoking in public places that kind of came in sort of 2006, 2007. And I think these results are interesting to see how that, all these policies together are having an impact on the rates of smoking, and it's perhaps something for people in other countries to look at, that focusing on these tobacco control policies can have a good impact both on the smoking but also on all these other things that are associated with smoking, like heavier drinking or people's mental health. not sure yet how e-cigarettes is going to affect, like, say, the trends of smoking that have been kind of in a favourable direction among young people, where the rates of uptake of smoking have gone down. There's kind of a concern that the introduction of e-cigarettes is going to kind of make smoking normal again. A lot of tobacco control policies have been trying to get at making smoking not seem normal. Kind of like bans in public places that kind of reduces the exposure to people seeing other people smoking. I think it's an interesting area of research to see whether that happens, or whether these e-cigarettes are going to have the potential benefits that people are talking about them having, getting existing smokers onto the e-cigarettes and protecting them from all the harmful effects of the tar and the tobacco smoke. There's a lot of research already kind of showing links between smoking and depression and anxiety symptoms. I don't think we're sure yet kind of really what causes that. And again, I think e-cigarettes are perhaps an interesting area for future research in there, because a lot of this sort of associations you might see between smoking and mental health might just be about who smokes, and those are the kind of people who also have mental health problems. Who smokes e-cigarettes might be a different group of people. If they're not showing the same kind of association with mental health, then it might be more about kind of who smokes or who smokes e-cigarettes. Whereas if you do see similar associations with a different group of people, then it might be more about kind of the nicotine, the physiological effect. Generally, a lot of people who do smoke say that they do it for kind of stress relief, but the nicotine itself is a stimulant, a bit like caffeine, that kind of rather than relaxing you, it kind of has the opposite effect.